If you choose a career in nursing, you choose a world of opportunity.
With a degree in nursing, you can do so many things.
Be traveling the world.
Alaska, Hawaii, Puerto Rico.
I've worked pediatrics, labor and delivery, postpartum, APU, which is the ambulatory procedure unit.
From operating rooms to remote airstrips, today's nurses serve on the front lines of every branch of healthcare.
I did ER, ICU, I've taught.
In acute care nursing, I worked on the floor with patients.
I'm a flight nurse for Life Flight Eagle.
Director of Education, I've been an ER manager, an ICU manager.
There are all different kinds of nurses.
The technology industry, developing healthcare software.
Specifically a mother-baby nurse.
I'm a clinical instructor. I teach in the graduate program.
Pediatrics at Children's Mercy in the ER.
You can go anywhere, you can do anything.
Emergency room, registered nurse.
Clinical research.
There's just so much about nursing that, the door is just wide open.
There are a variety of fields that you can go into.
Nursing has something for everybody.
I have gotten a lot of opportunities to spread my wings and fly.
Formal student training begins with theory, philosophy, and ideals of nursing, as well as practical, real-life experience.
This is the clinical simulation lab. We have several different what we call high-fidelity human patient simulators. This particular mannequin blinks, he breathes, he has pulses everywhere we'd expect to find one. You can check his wrists, you can check his feet, he has pulses present. He does have a speaker that our controller in the other room can speak for.
Thank you for taking care of me today.
So the students actually communicate with the mannequin instead of the instructor in the room. If we give him medications, he will respond. His heart rate will go up or down. He can die. They can resuscitate the patient. They can do chest compressions, whatever they need to do beforehand.
Direct patient care is still at the center of the profession, but the demands of a swiftly changing healthcare system constantly generates new challenges and will sharpen your talents and skills in ways you never imagined.
Healthcare is going electronic. Our mantra is one patient, one record, so that you can be in the ER and see the patient's record, you can be on the floors and see the patient's record, or the clinic, and you can see maybe in the clinic at a follow-up appointment, you can see what happened during their visit in the ER. We also note that with electronic health records, it's going to improve patient safety. We're going to eliminate documentation errors or misreadings, milligram dosage. It's going to prevent some medication errors, and it also help patient safety.
More than ever, nurses are assuming greater responsibility for patient treatment and recovery.
First, I think that nursing is more art than it is skill. People have to have a passion on the inside of them to do this job. What I find are my students that love people, my students that have a great attention to detail, my students that are critical thinkers tend to do better. But most of all, it's just having a love for people. Those students tend to do really well because that's what we do.
We have the stealth bomber. Those are my clientele. Those are the people I have to make certain they can fly, fight, and win.
As a nurse, I'm able to help with the care of that patient and can follow that patient throughout their care, even after they've been admitted to the hospital.
Men have the ability to be compassionate, that we have the ability to walk people through life and help them through whatever their healthcare issues just as well as anyone else. So
I know that what I do helps patients and it improves patient safety.
The connection you can make one-on-one with your patient and really make a difference, even though it's a very short amount of time that you're with them.
I had a guy that came in the ER, he was all blown up, and you have he's missing a leg, he's missing an arm, he could be losing an eye. You bring a person back from that and they say, thank you, I have a family, I want to live. And it's just you were in the right place at the right time.
That's really what the core of nursing is about, is that we get to provide support to people who need it.
Nursing is part of a multidisciplinary team. It's hard to imagine a job more diverse or more adaptable.
We have students who come in right out of high school. So I have students in there who are about 19, and I have students all the way through late 50s.
I'm currently a maternity nurse. This is what I applied for when I first graduated.
Coming out of high school, nobody in my family had really ever gone to college. That wasn't really pushed on to me. Didn't really realize the importance of that at the time.
We have students from rural Kansas. We have students from the very urban core of Kansas City.
I just kind of did this wander thing through life. No plan to go to college. Decided to go to college because I was living in a drug home and there was a lot of bad things going on in my neighborhood and I wanted out of the neighborhood. I'd been in college 2.5 years and had this great GPA of 1.9 and had decided then that I want to be a nurse.
Got into the medical field originally from volunteer work at a nursing home, and so I saw the nursing assistants and the nurses and what they did, and I decided to go to nursing school from there.
Just about 5 years ago, I had been an X-ray technologist for 13 years and just got a wild hair one day and started checking into the programs around and thought it would be a better option, more opportunity.
I would rather have a career than a job.
Nursing continues to be revised, reinvented, and revolutionized. Change and challenge are as constant as the desire to make a positive difference.
What I thought a nurse was, I saw the white dress, the cap, and standing at the bedside. So
it is not the 1950s nursing anymore. It is a living, thriving career that you can go somewhere in.
Nursing is part of a multidisciplinary team. It's hard to imagine a job more diverse or more adaptable.
My nursing degree has prepared me to do so many different things. Knowing that nurses have the ability to write computer programs, knowing that nurses jump out of helicopters, knowing that nurses help lawyers figure out legal cases, you know, knowing that nurses own businesses, knowing that nurses are CEOs and vice presidents of hospitals and other organizations. Just kind of this world opened up to me.
It's always a changing environment. There's never anything monotonous about it. The unexpected will happen. One day you'll have somebody who's near death and you can come in and provide the care to help save their life, and then the next day you're taking care of somebody who has diarrhea for 2 weeks.
Flight nursing allows a lot of flexibility, especially with schedules. At Life Flight Eagle, we work one 24-hour shift a week and one 12-hour shift a week, so you're actually working 2 days a week full-time. A lot of great experiences flying around and seeing the city from a bird's eye view.
Now I'm an ICU nurse. I work 3 days a week. We do self-scheduling. I will sign up for the days that I want to work. Usually end up with about one Friday and 1 or 2 Saturdays every 6 weeks, and that's it.
You can always find a job in nursing.
Imagine a job without borders and a career without limits. Now, you begin to understand the potential of nursing.